it is becoming clearer and clearer. I mean, look, there's a lot of different fires that are going to have to be put out over the course of the next 4 years. The first big fight, and perhaps maybe the one that we are most or best situated to, I don't know, win, or is really the right word, but win, I guess it is. And that is basically to keep Medicare, maybe Medicaid. I think the Affordable Care Act, I think it's there's going to be a real problem maintaining that. Here is, I mean, broadly speaking, let me just tell you what I think is, and we're going to spend some time on this. We're going to talk about it today. We're going to talk about it tomorrow, because if this is going to, this is going to be a massive fight. I don't know if people remember the 2005 fight against Bush to stop the privatization of Social Security. There was massive coordination amongst the center-left supporters of Social Security. I think Josh Marshall really made his mark at that time, where they started to have people comment on what their local congressman, where their local congressman was. They were creating a lot of pressure on Congress. There's less opportunity to do that with Congress this time, or the House anyways. More opportunity to do it with the Senate. And we'll get into that. But you people need to be armed with the reality of what they're proposing. Because they're, I mean, this, I think this goes without saying, but the Republican Party simply does not believe that government should be in a position to enable people to get health insurance. They don't believe that government should provide health insurance. They don't believe that government should provide health care. They don't believe that government should even enable one's ability to do so. Now, can they completely strip it away right now politically? They probably think not, and I think that's probably true. So what they have to do is strip away as much as possible, but make it sound like they're not doing that. I was at the 928, 912, or whatever it was, whatever that crazy Glenn Beck thing that he had going for a while during his crazy period. And I interviewed probably about 50 or 60 people. I went down there with a camera and a microphone. I think it was actually film guy Matthew was shooting it. And we have the footage somewhere. I think it's on our channel somewhere, like some of it anyways, where, there was just the most amazing amount of insanity that you could imagine. However, I asked every single person, should we cut Social Security? Should we cut Medicare? And almost to a person, I think there was one or two who said, absolutely. That was when this country went socialist in 1935 or whatever it was, 39. But just about the other 45 out of 50, 48 out of 50 said, oh, no, we should keep that because, people have paid into it, or, it already exists. For whatever that, I don't know. I don't know what the theory was. Medicare, Social Security for that matter, are so resilient and so durable because they're universal. And this means that you will be able to make the argument to people about Medicare who are traditional Republican voters. Older people are more aware of what it costs for health insurance and what health care costs, just because statistically they get sicker more often, or they know more people who are sick. And here is the dilemma, and here is the reason why And the Democrats failed to sell the Affordable Care Act, and in many respects. And there were also major problems with it. It doesn't go nearly far enough. It's not, it didn't really make things affordable, was also part of the branding problem.
Core brand proposition.
It did add 20 million people to the rolls of health insurance. But here's the dilemma you have from a political standpoint on health insurance. 80% of the costs of health care are borne by 20% of the people. So in other words, most people, particularly until they get older, but just the vast majority of people don't realize how bad their insurance is in terms of providing health insurance. They only judge it based upon how much it's costing them each month, which is not an unfair measure. But if you don't have a catastrophic situation and hit your lifetime cap within 8 months of being diagnosed with cancer or getting treatment, you don't understand the value of your health insurance. If you don't take expensive drugs on a consistent basis, you don't understand the value of your health insurance in mitigating those expenses. If you don't have a pre-existing condition, lose your health insurance because you switched jobs or you just didn't have the cash, you needed 3 months off, whatever it was, tried to get health insurance again, this is before the Affordable Care Act, and couldn't get it because you had a pre-existing condition, you're just not aware of these things. If you don't have children, you're just not aware of it, of the costs associated with it. So it makes it a very hard sell to people. In addition, you can't show them the parallel universe where there are rate increases that are slightly more or significantly more than you have in the Affordable Care Act exchanges. Okay, I'm not being an apologist for this legislation. I'm just explaining the political dilemma around it. So, with the Affordable Care Act, you have three essential elements to this. One is the Medicaid expansion, which added somewhere around 9 million people to the insurance rolls. Obviously, in many Republican states, it was never expanded, and it will never be. But and the next element is a series of regulations as to saying what health insurance must consist of to be considered health insurance. Right? Like, you can't sell a product that is water and with a little bit of like white coloring food and say, this is milk. You can't say it's cow's milk because we have regulations in this country.
Well,
same thing with insurance. Now, your health insurance is not health insurance if it can cut you off if you have to use it too much. If you get hit by a bus and you're in the hospital for 9 months, they can't say, well, you've reached your lifetime caps. Goodbye. It's not health insurance unless it provides certain benefits. Some elements of no copays on certain required, health things like a colonoscopy or providing birth control. Health insurance, not health insurance if it can be denied to you for pre-existing conditions, as we've talked about. And in this country, you can ride on your parents' health insurance until you're age 26. So that's the other sort of that's two of the three components. The third component are these exchanges, which are basically a way of organizing the individual insurance market that I don't know, 15 million Americans maybe participate in. And it's basically saying if you're one of those people, you can go onto this exchange, get insurance, and if you are within 140% of poverty, if you're between 133% of poverty, because Medicaid supposedly now expanded there, and those places where it expanded it, between 133% of the poverty line or up to 400%, you will get a sliding scale subsidy to subsidize that insurance. Is it still really expensive? For some people, yes. For other people, not as much. Depends on where you are, depends on how old you are, and whatnot. Understand that the idea behind the exchanges here was to smooth out the risk pool. And the risk pool is, if I have 100 people, how likely are X number of them to get sick this year? And that's how I determine how much I'm going to pay. One of the things the Affordable Care Act set up was risk pool subsidies for the insurance companies because they had no idea who would be in their risk pool now that new people would be entering the market for the first time because they were able to afford it. And so there was subsidies available for insurance companies to cover them if they underestimated how many people would go in there. Now, that was also curtailed significantly by the Republicans after the fact. Marco Rubio was actually a big part of that. And so a lot of these insurance companies left the markets. They were also left the market because they weren't required to sell only their products in those exchanges. And they started to realize, like, well, wait a second. Here's a crappy risk pool in this exchanges where for every 100 people, I'm just making up a number, 30 of them are going to get sick. But in the general population, only 20 are going to get sick. So let's sell to the general population because that's how we make money. We only have to pay out 20 claims. We got 100 people paying in as opposed to being in a situation where there's 30 claims and we've got 100 people in. So that's what started to happen in the Affordable Care Act. Fixing that is off the table now, so we don't even need to discuss it. So I'm telling you that about the Affordable Care Act because I want to explain how they're going to tear it apart and what they're going to try and replace it with and what the sort of the big lie about it's going to be. But then we're also going to talk about the big lie that you're going to hear when it comes to Medicare. Medicare, as you know, is health insurance program for, what is it now, 50 million Americans approximately, over the age of 65. People love their Medicare. For people who want more insurance, you can also get supplemental insurance as a Medicare. But I don't know anybody who criticizes Medicare. I've just never come across somebody. I'm sure there's some people, but broadly speaking. Medicaid is for people who are low income. It is a much tougher program, much harder to find doctors who will take Medicaid and whatnot. Medicare, it's not too hard to find doctors who will take it because everybody's in it, and they don't have much of a choice. They're not going to be in business, even though Medicare pays doctors 20% less than private insurance. And why does Medicare pay it? Because Medicare has the ability to buy volume in terms of care. They're the only game in town. And they also have the ability to know how much things cost because they can compare prices across the board. Medicaid is for low-income people. However, many elderly end up on Medicaid because you live your life from 65, 75, let's say 85, maybe 90. I don't know when this happens. It happens for different people. But let's say you need to go into a nursing home. Medicare does not pay for that. Medicaid will pay for it if you are basically out of resources. So many people spend down and have to spend down what they have, and then Medicaid takes care of the nursing home. So this affects seniors as well, Medicaid. All right, so let's start with Medicare. What Paul Ryan wants to do and what Tom Price wants to do, and they differ only in the details. But the broad strokes are this. They want to privatize Medicare. They want to give you a tax credit and a fee in which you will go out into the private market, which we know is more expensive than Medicare to administer. Of course, there's no profits in Medicare, right? I mean, you got to pay for profits with Medicare, 3 cents on the dollar. Private insurance, somewhere around 18 cents on the dollar. They're going to give you vouchers in the form of tax credits or whatnot. And you're going to go buy the private insurance. The growth of those vouchers is going to be stagnant. The cost of your insurance is going to go up over time. So you're going to get less and less value from the government to get health insurance. That's what we mean when we say vouchers or privatizing. The big lie that they will tell you is that this only affects people under the age of 55. Now, if you're under the age of 55, then you should be crapping your pants, because by the time you get to be 65 or 70, your ability to get health insurance is going to be greatly diminished. Because even if they start at a 1-to-1 cost ratio with tax subsidies to buying private insurance, by the time you get 15 years later, at the rate insurance increases now, imagine how it's going to increase when there isn't Medicare holding down, which Medicare is the anchor. Medicare is the lead in the balloon that floats up, that is the inflationary pressures of health insurance. Doesn't stop it all the way, but it slows it. You're going to see what happened when they started to cut public universities funding and charging students more money on tuition. Then the private universities said, like, oh, well, this is inflationary pressure. The guys who used to give it away for free or virtually nothing are now charging 5 times that. Well, we gotta raise our prices. We can. So by the time, if you're 55, by the time you're getting Medicare or whatever, the vouchers, and frankly, it's not Medicare. Again, I mean, I can take a milk container and I pour a bunch of water in it and I hand it to you and I tell you, it's milk. I call it milk. It's not milk. Medicare is a thing. And what it is it's social insurance, not a subsidy for private insurance. That's a different thing, but they're going to call it Medicare. The other thing that the other problem with their saying, and you got to ask yourself, like, well, it's such a great idea. Why would they want to punt it for 10 years? Right? Because, I mean, how many months would it take a 65-year-old to realize, oh my God, this is much better than Medicare? But the other problem is that, remember now, insurance works. Insurance is really just a function of the pool, the risk pool. So at one point, 55-year-olds go into Medicare. When those people turn 70, there's been no one entering in the risk pool for those 5 years. And the healthiest people in Medicare are the 65 to 70-year-olds, broadly speaking. It's obvious. They're the youngest. You're going to need those people in there to spread the risk. You're going to need those people in there to keep prices down, because the way that Medicare keeps prices down is that their patients, the volume of patients they have, give them the negotiating power. So it will screw it up for those 55-year-olds. And those 65-year-olds, and those 70-year-olds, in addition to screwing all of us who are younger than that. If you're 65 today and they implement this tomorrow, you're going to be screwed in your early 70s. Doctors, why would they continue to take Medicare? They know what's coming. We don't have to in the future. I'm going to reorient my business. So that's basically the broad strokes of the attack on Medicare. Hey, it's Sam Seder. Why don't you subscribe to this channel? You can do so right over here. Over. Subscribe.